name's Denisha. I'm going to be your RN today. Can I have you confirm your name and date of birth? Okay, I'm just going to double check that on your bracelet. Okay, hello Martha. So today your doctor has provided an order for us to do a catheter, an indwelling catheter insertion. We're going to obtain a sample of the urine, and then I'm going to go ahead and take that out. Do you have any questions about that today? Okay, so you have a good understanding about it? Okay, great. So first thing I'm going to do is I'm going to go wash my hands, provide you some privacy, and then I'm going to gather all the supplies that I need to do the catheter insertion today. Wash my hands. Make sure I have a trash can. This is what I'm going to use to keep the catheter connected to her inner thigh. My catheter kit, which I have verified with the provider's order, it's the smallest size available. And so since I performed hand hygiene, I'm going to put on some just regular clean gloves. And Martha, can you tell me today, if you're experiencing any pain on a scale of 0 to 10, what would you rate that? A 0? That's good. Okay. So the first thing that we do, I'm just going to expose your belly real quick. I'm going to palpate your lower abdomen and just make sure it's distended, and it sure does feel distended. Did you feel any tenderness or uncomfortableness while I was doing that? No? Okay. I'm going to, first I'm going to clean the peri area. I'm going to pull this back. And then these are my peri wipes. This is a wet one with water and soap on it, and this is a dry one. And I normally use a brand new sheet each time I clean the area. So I'm going to apply a chuck below you, just to make sure we don't get your bed too wet and soiled. Make sure her legs are in the butterfly position, and I'll clean from front to back. And again, just one stroke, grab a new one, right down the middle, grab a new one. Discard that in the trash can, and now I'll dry it, pat dry, new towel, new towel. Alrighty, so here I'm going to do a glove, provide her some privacy, do a glove change, put on new gloves. Just kidding, I'm going to discard these because I'm now ready to insert the catheter. Okay, I'm going to open up my catheter bag. How you doing, Martha? Good? Good. Kind of a tough bag. Okay, I'm going to pull the sheets back a bit more. And then next to me I've got my clean gloves and that anchor for the catheter. And then I'm going to use this bag to discard of some of my supplies from my sterile kit. Okay, so to set up my sterile kit, I'm gonna again perform hand hygiene with hand sanitizer. I'm gonna keep this because I'll need to date, initial and date the catheter bag. And the way that I'm gonna set up my sterile kit is like this. Straighten that out, move it back just a bit. Okay, first thing I'll need to do is get my sterile gloves on. fix my gloves now. Man, these gloves are a little small, Martha. Okay, got them on, and we're good. So I'm gonna go ahead and discard of that. Okay, we're good. Okay, now this is going to go right below you, and we're gonna be sure to put the shiny side down. Wrap it around, get it right below her bum, and she's just going to kind of help me out by raising herself up a little bit. And then this is going to go, this is the fenestrated chuck, which is just going to go right around her lower half and just expose the labia and the meatus. So before I do anything else, I'm going to get all my kit ready for inserting the catheter. That. This is the lubrication gel. Sorry, this is the lubrication gel. Rip that off, and I'll just go ahead and squeeze it out into my little tray here. Get rid of that. And now I've got the iodine antiseptic solution. So I'm gonna open these up. And before I even came in the room, I validated that she didn't have any history of allergies to iodine, but I'm just going to confirm. Do you have any history of being allergic to iodine, Martha? Okay, great. So each one of these, I'm going to go one swipe, discard of it, another swipe, discard of it, and then right down the middle, discard of it. And at this point, I'm going to go ahead and inspect the meatus, and I can visually see it, and it looks like it's in a good position. So taking her catheter now, I've got about 10 centimeters exposed. I'm gonna lubricate that, and then using my non-dominant hand, I'm going to spread the labia, and I'm going to insert the catheter now. And at this point, I can see a flashback. I can see some urine come out. How are you feeling, Martha? Are we feeling comfortable? Okay, great. So this hand is now, it's not sterile any longer since I've touched her. So I'm going to hold it with this side, and now I'm going to fill the balloon with saline. So that balloon has filled up. And I tug on it, and there's resistance. Take that out. And then now we're done with the sterile process. So I'm going to go ahead and get rid of these gloves. And we are going to get a new pair of gloves on. Just regular clean gloves. Okay, Martha, and then at this point, I'm just going to obtain the sample that is needed for the urinalysis. So I'll go ahead and adhere this to her inner thigh. Gee, my Velcro is very sticky. And I do want to make sure that I can see that she'll have a little bit of range of motion. And it's not too tight on her legs. That comfortable, Martha? Okay, great. Okay, so we're gonna make sure that the catheter is hung here on her bed rail. While I'm doing this, Martha, I'll kind of just let you know why we want it to go below the bed rail. We just don't want hanging it lower below your waist is just going to kind of use gravity as its advantage and drain the urine out. We don't want it to go backwards back up into your bladder. That would do complete opposite of what we're wanting. So now I'm going to obtain that sample. Okay, so I'm going to go ahead and just clamp right here below the port where I'll be pulling that from. Okay, and I'm in there. I'm going to pull the sample out from here. Good enough. They get that put into there, into the cup. Send that off to the lab. Get rid of my hemostat. And I'll do another glove change at this point. Normally, so I would have already had my catheter bag, initial and the date that I inserted it. But we're gonna go ahead and remove it now. So now I have a new clean pair of gloves. I'm gonna go ahead and remove this from her. And now I'm going to take my syringe and I'm going to deflate the balloon now. So we're going to pull all of the water out of that balloon. How are we feeling, Mary? We comfortable? Okay, I think we got it all out. So I'm gonna go ahead and tug back. So now I'm gonna pull this out. I'm just gonna have you exhale slowly, okay? Okay, we've got it out. When I had already drained this prior, since it was only in a short time, there wasn't a whole lot to drain. But I would record the input and output of the urine, and then I would discard that in the toilet. And then I'm going to go ahead and just clean up all of my supplies here. Make sure we get her covered up. Dispose of everything. Just going to get this all in a trash can. Call that the trash can. Get rid of my gloves. Okay, now I'm just gonna get you comfortable. I just performed some hand hygiene before I touched her. Okay. All right, Mary, how do you feel? Do you feel like you have a good understanding of why we did what we did today? Do you have any other questions? Since we did relieve a lot of that pressure that was in your bladder just from taking the urine out, I'm still going to encourage you to regularly drink fluids, keep doing what you're doing, and if you feel a little uncomfortable, maybe a little bit of burning, next time you urinate, that's completely normal, okay? So here's your call light, and feel free to let me know if anything else comes up, okay? Hello, good morning. My name is Denisha. I'm going to be your nurse today. It looks like the doctor has ordered for us to insert an NG tube to aspirate some of your stomach contents, and then we'll just take it out quickly after that. Can I have you confirm your name and date of birth? All right, let me just take a peek at this band. Perfect. So how are you feeling this morning, Martha? Pretty good? Good. Do you have any pain before we get started? No? Any allergies that I should know of? Okay, that's perfect. So first thing I'm going to do is provide you with some privacy, and I'm going to do some hand hygiene. And then we're going to get some vital signs taken. Pretty important that I get this pulse oximeter on you. This is gonna be my pulse oximeter. We're just gonna place it on your finger and keep an eye on it throughout this entire process. So, do you have a good understanding of what we're doing? Any questions before we get started? Okay, awesome. So let me pop your head up just a little bit. Or you're actually in a pretty good spot, but I'm gonna take this rail down so I don't have to work over it. Actually, let me first assess your patency of your nostrils. Get some gloves on. Or some hand hygiene. Get these gloves on. We breathe in and out, in and out. I'm gonna take a peek. And this looks like the better side for us to put it on. So I'm gonna come to this other side. I'm just gonna bring this one with me. Alrighty. So don't worry, I'm gonna walk you through the whole process and make sure that I communicate with you what to expect. I'm gonna place this chuck on you so that we don't soil your top. I'm going to make sure I've got all my supplies laid out. Looks about right. And I'm going to take this lubricating, or just lubricant, to get this NG tube ready. All right, so we got that pretty good. So, oops, okay. I probably should have done that first. I wouldn't have done that in real life because I'm gonna need to measure her measurements on the tube first. So without touching her face with this on here, measure from the nose to the ear, or about 15 centimeters. And then I'm going to go from here to the xiphoid process, right there at 45, and then I add 15 centimeters to that, which puts me at 60 centimeters. And I will mark that with a pen that is safe for this. Okay. All right, Martha, so I'm going to give you a cup with some water in it. I'm going to have you hold it and just continue to continue to swallow this as I go through. So, or I can have another nurse assist me with doing that if you don't feel like you can hold it on your own. She feels pretty good about it. We're gonna go ahead and insert the NG tube now. And we have assessed her gag reflex and everything's good here. So I'm gonna pause a couple times just to assess that we're doing things correctly. When I get to the 15 centimeter mark, we're gonna take a break, and I'll let you know when we're ready for that, okay? So we're gonna insert the first 15 centimeters. We should be in the nasopharynx at this time, so I'm gonna take our oropharynx, and it does appear to be in that. Keep drinking that water. We're gonna get to the 30 centimeter mark, and this is where I'm gonna listen for air. I don't hear it. That's exactly what we want. Make sure we're in the right spot. You're gonna go ahead and advance this to the 60 centimeter mark that we've got. You're doing great, Martha. Just keep drinking that water. We're almost done. Alrighty, we're there at 60 centimeters. Great job, Martha, you did awesome. So we're going to use, I'm gonna get new gloves because I got a little bit of that lubricant on my hands, so got new gloves. So normally we'd have x-ray just validate that this is in her gastro area, not in the lungs. And we're gonna assume that they did that and we're good. So I'm going to first apply this to the nose. Keep it secure. Kind of tricky with gloves, but we made it work. And then I'd also apply another piece of tape to the face. had one of these put in before, Martha? Oh, you have? Oh, you're a champion. Okay, and then I'm going to clip it to her gown as well. Okay, so I'm going to get new gloves now. I did hand hygiene in between that. And then we're going to suction some of that gastric content. So I'm going to attach this valve. It's a 3-way valve with a locking mechanism. Oh geez. It's really on there. There we go, cut it off. So I'm going to connect it to the NG tube. Make sure it's locked first. I'm going to go ahead and grab the suction, make sure it's turned on, connect it here, and we have the suction turned on. I'm able to visually see this contents passing through. It's exactly what we want. Now I'm going to go ahead and turn it to the off part on here so that we're not going to get any suction going backwards, and I'm going to aspirate the contents. So first I'm going to aspirate, or insert some air, sorry. We're going to go 10 ml at a time. Then I'm going to pull back the air that I inserted, that 30 ml. We doing good, Martha? You're doing great. Go ahead and let that suction again. I'm going to put that content into our container here, and then using my testing strip, make sure that's saturated well, and let it sit there while we'll get the results here in a little bit. Basically, we're just assessing the pH of the gastric contents, and then the provider will review the results. Okay, so how are we feeling? Are we feeling like it's time to get this out of there? Okay, great. So, to remove, I'm going to first turn off the suction. Got that off. Place that back up top. We got that chuck on. I can just leave that on. It's in the off position, so nothing's going to come out and backflow onto us. Going to remove the tape and the little clip that we use to hold it onto your gown. Okay, Martha, so this is where I just need you to just take a deep breath for me. And we're just going to pull this out and try to do it in one clean motion for you. Perfect. So I'll just validate that everything came out. We didn't end up having it break off or anything. It's all intact. And I'll dispose of this accordingly and get the results of that stomach contents to the provider. Do you have any questions today, Martha, about what we did? How are you feeling? I'm gonna provide you with some oral care just to make you feel a little fresh and better in there. Feel good? Okay, spit that out. Awesome. Okay, take this away. Go ahead and get rid of my gloves. And I'm gonna take that pulse oximeter off of you. You did great the whole time. Okay, do you want to lay back or do you want to be in an upright position? What's going to be best for you? Upright? Okay, I'll just leave you how you are. Alrighty. Okay, it's been great. I'm going to go document this and provide those results to the provider.